Hello students, today we will discuss about the interview. The interview is an integral part in the way we can collect subjective data. Through interviewing, we gather the data that consist of sensation or symptoms, feelings, perceptions, desires, preferences, beliefs, ideas, values, and personal information of our clients. This data that we gather through interview are considered subjective data because these types of data can only be elicited most of the time and verified by the client himself or herself. What does this subjective data do? They provide us clues to possible physiologic, psychologic, and sociological problems of our clients. They as well provide us with information that may reveal a risk or a problem that could happen in our client or that are actually happening, as well as areas of strengths that we can use as we take care of our client. So the information that we get, therefore, during our interview has to be complete and accurate. And we can only do this if we use or employ effective interviewing skills. Now, what is an interview? It is a structured communication process. Most of the time, when I say structured, we have a guide as to what types of data or what are the specific data that we need to collect. We need to gather specific information. Aside from that, interview is to establish rapport and a trusting relationship with our client. Usually, the interview is the first or the initial contact that we will have with our client. And also, we need interview to gather information on our client's developmental, psychological, physiologic, sociocultural, and spiritual status. So during the interview, the nurse facilitates the discussion as he or she collects and record the data. So as what we have said, an interview is a structured interaction with our patient. We need to gather specific data. Okay, we use questionnaires as a tool, although um, this is not something that we just read in front of our patient. They will mostly be guide for us the questionnaire so that we can collect the health history and the information that we need to. And so this questionnaire should never be a substitute for an effective interview. Although through a questionnaire, we can gather past medical problems or symptoms as our client will reveal to us. There are factors affecting the effectivity of our interview. Of course, you will have the physical setting. It is very important for us to ensure that we have a setting wherein our client is comfortable, wherein privacy and confidentiality is obviously taken care of and considered. We also have the nurse's behavior. How we are doing the interview affects the quality and the type of data that we can gather. We also need to be mindful of the types of questions that we ask, how we ask the question, and the personality, of course, and the behavior of their client at that specific point in time. It is very important for us nurses to be able to know the personality and the current behavior of our client because that would strongly affect and influence the feelings of our client at the specific time. We cannot conduct an effective interview if our client is anxious, fearful, or angry. as well as the nature of the information being discussed would also affect the interview. Sensitive information, when discussed, has to be dealt with carefully because the data, the accuracy, and the completeness of data could be affected. So there are several phases of the interview. We have the pre-introductory phase. At this point, if possible, it is important for the nurse to review the medical record before he or she meets up with the client. The information that she can gather during this pre-introductory phase may assist her or him in how he or she conducts the interview, because by reading or having initial information about the client, then she would know the client's biographical data that are already documented. Or, like, for example, if the data of the client is in the system already, if there is access to electronic health record, then the history of the clients would be available for the nurse to take note of. So this information could guide the nurse as to which side of the client would be best to conduct interview. The record could reveal the client's reason for seeking healthcare, his or her past health history. But if, for example, this medical record is not available, okay, so it is important for the nurse to rely on her interview skills to gather valid, reliable, and accurate data from the family, from the client's himself or herself, or the client's significant other. We have the introductory phase. After you had introduced yourself to your client, you need to explain the purpose of the interview. Why are you conducting the interview? Discuss what type of question will be asked. Like, for example, you will have to say that I will be asking you about your personal information, and that I will be taking down notes, and you have to reassure the client that confidential information will remain confidential, and what you have gathered there from the interview itself would be considered confidential. So, this is to ensure that the client is going to trust the nurse or establish a relationship with the nurse. As well as during the introductory phase, it is very important to be mindful of the client's comfort, both physically and emotionally, and to provide privacy in the event that complete privacy in a setting is not possible. Then the nurse can probably take note of a space wherein they can talk privately, or use curtains to allow division between other people and the client. As well as it is at this introductory phase that we develop trust between us and the client, as well as establish rapport. So we can do this by conveying a sense of priority and interest in our client and what he or she is going through. When we develop and we establish rapport, it is very important as well to be mindful of our verbal and non-verbal communication. So again, what happens during the introductory phase? The nurse introduce himself or herself to the client, describe the purpose of the interview, and what is the role of the nurse, that is to gather the data, to record the data. And so the introductory phase is the first, no, the first opportunity for the nurse to make an important impression or first impression with the patient. Okay? And the nurse should see to it that he or she conducts herself professionally so that the nurse would convey a professional demeanor or appearance. And that includes how the nurse appears, her appearance, her body language, her tone of voice. You need to address the client by their title and surname. Okay, as much as possible, avoid using their first name unless they tell you or they request you to address them in formally. Okay, and sometimes if you're talking with adolescents and children, it would be possible that we can talk to them through their, or we can address them through their first name or on a first name basis. Also, avoid substituting the role, like for example, calling someone like nanay or tatay or lolo or lola. Again, it is important to call your client through a title, Miss, Mr., Ma'am, Sir, and then calling them by their surname. Okay? And then it is at this phase that you need to explain what to expect. Like, for example, what are you going to ask her? How long would the process take? Okay, so that's the introductory phase of the interview. In the working phase, the nurse now gathers the data from the client, like asking the client about important biographical data, the reasons for seeking care, the history of the present health concern, the past health history, family history. The nurse does review of body systems for current health problems, lifestyle and health practices, as well as developmental level. As the nurse conducts the interview, the nurse listens, observes cues and other nonverbal communication provided by the client, as well as use critical thinking skills to interpret and validate information the client provides. And the nurse and the client collaborate to identify the client's problem and goals. This approach may be free flowing, of course, using a guide, or it could be more structured with specific questions. It depends upon the time available and the type of data needed. So the nurse facilitates and maintains a patient centered discussion. So during the working phase, it is important for you to know and be mindful that the communication process or the conversation is centered on the patient or the client. In so doing, during this working phase, it is important to use different effective communication technique to gather or to collect valid and accurate data. Okay, so after the working phase, you now move on to the summary and the closing phase. During this phase of the interview, you summarize the information you have obtained during the working phase to the client so that the client validates the data that you give back to her. Okay, as well as validate problems and goals of the client. The nurse as well identify and discuss possible plans to resolve the problem. The nurse can provide at this point specific nursing diagnosis and collaborative problems that needs to be referred to appropriate members of the healthcare team. And then the nurse during this phase make sure to ask if there is or there are anything else that concerns the client and if there are further questions that the client would like to ask her. Okay, so during the summary and the closing phase, the nurse summarizes the data with the patient, allows the patient to clarify and validate the data, and then communicates an understanding of the problems to the patient. How do we ensure a successful interview? First, we need to make a good first impression. We need to do this so that no we our client can look at us as being a professional person, and that what we're going to establish to her or him is a professional relationship. Okay, so it is very important for the nurse to be mindful of her personal appearance and body language. It is important for you to look as simple and as professional as possible without too much jewelry that could distract the attention of the client from the interview. And um, as well as it is suggested that when you do your interview, you can as well wear your laboratory gown or your professional blazer, so that the client will really have that good first impression of you. It's important for you to wear your identification or your ID as well as your credentials. Okay. The purpose of making a good first impression is to facilitate the establishing of trust from the client to your capacity to provide her the care that he or she needs. And then be prepared. Again, if it is possible and the record is available, review the client's medical record before meeting him or her. This allows you to have an initial picture of the client, and then helps you anticipate some issues that would arise as you do the interview. Okay, at the same time, when the client knows that you had prepared, you had done initial reading about her or him, then the client would know that you are interested and you invested time before meeting him or her. Be attentive. Okay, be attentive all throughout the interview. You listen well. Okay, it is important to inform the client that you will be taking down notes, but your documentation should not take you so much away that you are more focused on writing than in providing a listening ear to your client. You need also to use questioning techniques to optimize the conversation. And again, avoid using medical jargon or medical terms. Keep your conversation as simple as appropriate, and make sure the client understand what you are talking about. What are the factors affecting the interview? First, we have the physical setting. Okay, that includes where or the location of your interview. So you need to consider that because it can create an impact, or it has a very important impact on the exchange of information. As much as possible, conduct the interview in a private, quiet, comfortable room. Okay, free from as much environmental distractions as possible. Choose a place where you and your client can sit face to face. Okay. Also, choose a place where privacy is ensured, especially if you're discussing issues that are highly personal. Okay. Because if your client is being distracted by the presence of other person around, he or she may not be willing to share sensitive information openly and honestly for fear of being overheard. Okay, sometimes we initially talk to our client before we talk to other members of the family, especially for sensitive issues like drug use, sexual activity. Okay, we have a protocol, like, for example, when we talk to teenagers, we usually talk to them individually, and then we talk to them with the presence of their family members who went with them. Okay, so privacy is very important, and usually we can assure this if we conduct interview in an unoccupied room or just you and the client. Usually, this could be an examination room or a private hospital room. However, if there is none such thing, and if the physical layout, okay, makes it difficult to find a place that would allow you, only you and the client, to have a an interview, then you need to ensure, okay, you need to employ other measures to allow as much privacy as possible. So this could mean drawing the curtains to provide privacy, and to block out visual distraction. So we need to take note as well of the physical comfort of our client. Like, is the room too cold or too hot? Okay, so during this time, we allow our client to remain in her clothes. Okay, no need to change into a patient's gown or hospital gown at this point, because we want him or her to be as comfortable as possible. So how far would you sit from your client? Okay, so we would say that sit at a distance, okay, that provides a comfortable flow of conversation. It's very important to observe personal space. So it's usually the amount of space the patient needs varies and could be influenced by his or her culture and previous experiences. Like, for example, if your client has history of um, physical or sexual abuse, being too close to your client could be intimidating for him or her. So be very attentive to how comfortable your client appears. So if he or she doesn't feel or look comfortable, then you could probably ask her if the sitting arrangement is okay with him or her, or you can ask her if the the room is too cold, or do you need to adjust the temperature of the air condition. And then ensure that the interview is conducted in a quiet setting without distractions, because of course when you are talking with your when you are conversing with your client, we would like to eliminate unnecessary noise, and we would like to remove as much distraction as we can. So, if possible, turn off any communication device like your cell phones, okay, except if you have to, like, for example, you are in an emergency setting. Also, one of the factor is our professional behavior. So they would say that first impression lasts. Again, be mindful of how you look, your appearance, okay? How you dress, your grooming. So it's important to dress modestly. Ensure that your fingernails are clean. You are wearing just the appropriate jewelry. Your hair is neat, and it's very important, right? We It is encouraged for nurses who have long hair, curly hair, to keep them in a bun, to ensure that she has this appearance of being neat. Okay, so that this type, your how we dress, our manner, okay, our appearance would not be an obstacle or a distraction to the client's response. Okay, and then at the same time, we have to be mindful of our interpersonal skills because this could make or break, okay, our interview. We need to convey a professional yet a warm demeanor. Okay, like a friendly demeanor, but a professional demeanor, not a stiff or overly formal attitude wherein your client may not be comfortable sharing data with you, as well as like do not be too casual or like you're just taking the interview lightly because this may diminish the confidence of your client to your ability as a nurse. And then show that you are actively listening to your client. Okay, project a genuine interest in what they're saying. Okay, they our clients need to feel that they are understood, we understood them, and so we have to make every attempt to understand their point of view. Okay, and how we present ourselves to them, communicate acceptance, okay, as well as respect to them, to their individuality, to their person. Failure to project this kind of behavior could jeopardize the flow of information. Another one is that we need to avoid being careless with words. Okay, so you are reminded time and time again that um, comments that could like be just innocent for us could be interpreted differently by our client. Okay, so like for example, if you're talking about sexual preferences, so please be careful with that. Okay, or commenting on a client's physical appearance. Okay, so we have to be mindful of our comments as well. Take note of your non-verbal behavior. Okay, so aside from being careful with your words, take note of your reactions. Okay, as much as possible, avoid extreme reaction. Like when a client tells you something, you act like you're surprised or you disapprove of it. So as much as possible, maintain that calm and accepting demeanor. Okay, so that our client will be encouraged to open up and trust us more. And then avoid focusing on recording the data. Although you will be writing from time to time, it is important that you make it appear that you are focusing more on your client. Okay, you need to listen first and then you document. We also need to consider patient-related variables. Okay, what are these? These are your patients or your client's age, the physical, mental, and emotional status of your patient at the time, because uh, an angry, anxious, or fearful patient might not be in the best ability to provide you with substantial as well as accurate information. And then it is important to for our patients as ideally to be mentally alert, okay, and not experiencing physical or emotional discomfort at the conduct of an interview, because doing an interview with a client who is in physical or emotional distress is difficult. Okay, it is in case you have to do that at this type of situation, you can use a focused assessment to limit the number of questions, the number of information that you would like to elicit. So you need to do a focused assessment. Should your client be in should your client present or in a physically or emotionally distressful state? And then The art of asking question, how we formulate our questions is very important, okay? How we ask them as well. So question must be clearly spoken and understood by the client, okay? Should the client not be able to understand, okay, you can interpret it in layman's term, but avoid as much as possible using technical terms, okay? Use words or terminologies familiar to your client, and you can use slang words such as when you talk about urination, you ask you use the terms pee, okay, and it may be needed at a point in time so that our client understood, but it is very important for you to as well take note if the use of these slang words are appropriate at that time. Adapt questions to a patient's or a client's developmental level, knowledge, and understanding. So, like for example, if you're talking to a young child, you're asking the young child where in the body it is hurting, then you might ask the child to point it to you, okay? But for if you're talking to an adult, you might ask for more details such as the onset, the duration, and the characteristics of pain. Nevertheless, we encourage our clients to be as specific as possible. Okay, so we avoid taking what our clients would say. For example, like we ask our client, how many times does she have this physical exercise every day, every week? Probably your client will say occasionally, and then you would have to clarify it. How many times is occasional? Okay, so you let the client provide you with specific information, like for him or her, it occasional would mean once or twice a week. Okay, also ask one question at a time. Okay, don't bombard your client with multiple questions. You wait for your client to reply before asking the next question. Okay, when we ask our client several questions at a time, we might confuse the client. Okay, so like for example, we ask the client if he or she already had her vaccination on like tetanus, on measles. So you need to ask her first, you need to wait for her to answer if she had been able to, if she had been vaccinated with anti-tetanus, and then for measles, and so on and so forth. Okay, so we need to wait for the client to answer, because if we bombard our client with multiple questions, the client might be unsure, okay, of what to answer first, or the answer that we might get, we might not know what particular question our client is answering. And then we also need to clarify. Okay, so when we clarify, we ask for an explanation about your client's answer, because we want to um, be sure that our client really understood the question that we asked. We need to be attentive to the feelings that accompany our client's response. Okay, this may need some information that would affect the care that we would be providing our client. Okay, when asking questions about sensitive issue, we need to explain, okay, that that we need to ask personal question, okay, and that we need this information to be able to identify his or her problems and how the healthcare team could help her in that situation. During the interview, your client may ask you questions, okay? Make sure that you answer your client in terms that he or she can understand, okay? You answer the client's question as he or she asks, okay? In as much as we want to provide all the information that we would like to provide our client, we need to avoid giving long information or deep answers because this might confuse our client. Okay, so there are two types of communication. We have the nonverbal communication and the verbal communication. So, how do we communicate non-verbally? First, we communicate through our appearance. Yes, it is important that our appearance exudes professionalism because, well, of course, at that point in time, your client is expecting to see a health professional. Therefore, you should look professional, okay? So, wear comfortable, neat clothes, a lab coat, or a uniform, okay? And be sure that your name tag, including your credential, is clearly visible. Okay? As much as possible, your hair should be neat and not in any extreme style. So if you have long hair, it would be helpful if you pull it back and you as well take note of the neatness of your fingernails. Your makeup should be minimal as well as your jewelry. And then our demeanor, okay? Again, our demeanor as well as our appearance should project professionalism, okay? When we enter a patient's room to interview, we need to display poise, okay? A relaxed and calm manner, okay? Focus on the client and the interview and the assessment. As much as possible, do not enter the room laughing loudly. Like, for example, you opened the door and you were chatting with a coworker. Okay? So, when you're doing that, it could provide a, a picture of you just taking the interview lightly. Okay? Or when you enter the room, you be as poised as possible. Okay? Because if you enter the room loudly or you're talking to a coworker or you're muttering something, then this would appear unprofessional. And this will have an effect in the entire interview process. When you enter the room, don't forget, no, always, okay, don't forget to greet your client. How do you greet your client? Greet your client calmly and focus your attention to him or her. Okay? Do not be overwhelmingly friendly or touchy. Okay? If this is the first time that you have met the client, they might be uncomfortable if you immediately touch them. But it's important to introduce yourself at the same time, offer a handshake, okay? And maintain a professional distance. Okay. Your facial expression. Of course, your facial expression um, provides your client a view of how you are at that moment. So, if it's very important to be mindful of your expression because it will show what you are thinking, how you are feeling. Okay. So, no matter what you think about our client or what kind of day you're having. If you're not having a good day, keep your expression as neutral and friendly as possible. Okay? If, like, for example, you cannot hide it, you feel angry or anxious, you can explain why you're feeling it. So, like, for example, you feel sad because of this and that. Okay, so that your client may not feel like your anger or anxiety is because of his or her presence. But if you can hide your emotions, it's very good. Okay, so that you will appear neutral and friendly. Okay, but being neutral in your expression does not mean you lack expression. Okay, it's just using the right expression at the right time. Okay, you should, like, for example, if your client is upset, then you can show or make yourself appear as understanding and concerned as possible. So, like, for example, is your client is smiling, then you can smile back. Okay. If your client is in the verge of tears, then you can have a concerned expression. So, it is important to have the appropriate expression at that point in time. And then the attitude, okay? One of the most important nonverbal skill that we need to develop as healthcare professional is a non-judgmental attitude, okay? So that means all of our clients should be accepted regardless of his or her beliefs, ethnicity, social status, lifestyle, and healthcare practices. Okay, as well as try as much as possible not to act as though you feel superior to your client, or like you appear shocked or disgusted at what your client is telling you, or you show surprise at what you're being told. This could make your client feel uncomfortable and could prevent your client from opening more to you. So that means your client would keep important data concerning his or her health status. Okay? So avoid preaching, like imposing your own sense of morality or ethics on your client. Okay? Please avoid that. Okay? Focus on healthcare and how you can best help your client achieve the highest level of health. Okay? Like, for example, if your client is telling you that she has had multiple sexual partners, you avoid lecturing her, okay, about the why she should not have done it. Okay, because that is showing judgment of our um, clients' practices. Okay, as much as possible, our attitude should be non-judgmental, because if we show, let's say, judgmental attitude, if we become preachy, okay, if we become imposing of what we think is right, that will harm the nurse client relationship. Okay, and in so doing, of course, your client will stop from telling you other important data as well, because we are forcing ourselves, our beliefs on him or her, and that is very unhelpful and not therapeutic. Okay, again, accept the client, show understanding of the habit, and convey an attitude that you and your client can work together to improve his or her health status. Of course, that this should not mean that you will not, no, encourage your client to change his or her behavior, risky behavior, or change he or make changes in her lifestyle or practices. It only means that at that point in time, you are there to gather data, okay? And that you are there to help him or her achieve his or her goal, okay? You let your client know that you understand that lifestyle changes or whatever unfavorable experience he or she had or behavior that she had must be hard on her part as well. Okay. uh, so it's very important to keep a non-judgmental attitude. And then silence. Okay, so silence is something that we are not easily accustomed to, right? There are times that in the process of your interview, you can have periods of silence. And if your client is silent, this means that you can allow that, okay? Because at this point, maybe your client is reflecting and organizing his or her thoughts, okay? So don't be in a hurry to break the silence. Allow your client to have that, okay? So that she or he can provide a more accurate data or answer to your question. And we have listening. Okay, listening is the most important skill to learn and develop fully in order to collect, complete, and valid data from your client. So, how do we listen effectively? First, you need to maintain good eye contact. Okay, does it mean staring at your client all the time? Of course not. That is maintaining appropriate eye contact. Okay, not staring at him or her and not avoiding eye contact as well. So you can smile or display an open, appropriate expression based on what your client is sharing, based on the expression of your client as well. Maintain an open body position, okay, like open arms and hands, and you can probably lean a little bit forward so that your client, you will convey demeanor that is interested to listen to him or her. Avoid preconceived ideas and biases about your client. So you can do this by being um, understanding of your client at the same time knowing your biases and then trying as much to address them because we need to listen to our client, okay? And to be an effective listener, we have to keep an open mind. Any judgment or preconceived biases that we will have might hinder us from collecting the accurate data. Avoid crossing your arms, okay? Because that would convey a disinterested attitude, or avoid sitting back, like, for example, you're not taking your client seriously, or constantly tilting your head away from your client. Also, avoid thinking about other things, okay? Like showing a blank or inattentive stare, okay? And then concentrate, okay? Keep practicing this, okay? How you concentrate. In summary, what are the nonverbal communication to avoid? First, excessive or insufficient eye contact, okay? So you, my client may feel uncomfortable if we have too much eye contact with him or her, okay? Or if you don't establish eye contact with him or her, the client might believe that you are hiding something from them, okay? So use eye contact appropriately and moderately. Okay, so while your client is talking, you can probably look at him or her. instead of looking down at your notes. Okay, so you can look down at your notes, you can write from time to time. Okay, also with regards to eye contact, it is important to take note of the cultural background of your client, because for some cultures they might think that eye contact could be like disrespectful. So it's very important for you to know your client's cultural background. Okay, avoid distraction and distance. Okay, avoid being preoccupied with something else, like while you are doing the interview, like tinkering on your phone or answering a call. This would make your client believe that you are not really focusing him or her. Your client may think that the interview or your client is not important to you, okay? As well as avoid appearing mentally distant as well. Our clients are very sensitive and they will sense it if you are not really there. Okay, you might be there physically, but mentally you are somewhere else. Okay, it will be also important to take note of the distance between you and your client. It should not be too close or too far. Okay, as much as possible, we don't sit or we don't get near a client. Lesser than 2 feet, and take note that we're not that far, no, not too far from our client as well, because again, if we are too far from our client will think that we are not interested, or if we are too close, our client may feel uncomfortable. Okay, so it could either be portray a non-caring attitude. Okay, and then we have avoid standing. Yes, as much as possible, you and your client will be on the same eye level. Okay, so if your client is seated during the interview, it would be important for you as well to sit down during the interview. Okay, because if you're standing, there is a different level. There are different levels. Okay, between you and your client. So you standing might be perceived as superior, or you are trying to make your client inferior. Okay, so the relationship that you have with your client should be an equal partnership, okay, between you and your client, because if our client feels inferior, he or she will not feel empowered, okay, to be your equal partner in establishing or moving towards optimum health. Okay, or if your patient or client feels inferior, he or she may not reveal the exact data that you want to know. Okay, as your client might be distrustful and might look at you as unworthy or untrustworthy, judgmental, or disinterested. Aside from nonverbal communication, we need to also know how to do verbal communication. So, one of that would be the open ended question. So when you say verbal communication, that's the use of words, right? So our verbal communication has to be effective also. So we need words to gather data to ask questions. Okay, so when we say open-ended questions, these are questions used to elicit our client's feeling and perception. Okay, um, these questions typically begin with how or what. Okay, so when we ask, like, how are you feeling today? How are you feeling lately? So our client will not just be answering us with a yes or no, they could provide us more data. Okay, and then we have, of course, we also need to ask closed ended questions. So this would be questions that would elicit specific information. Okay, like yes or no, like how many times have you urinated today, or um, since when have you had that problem? Okay, so those are closed ended question. Okay, so we need to also use this type of question. So these are useful in keeping the interview on course. Okay, they can be used to clarify or obtain more accurate information about issues given to us by our clients. So, like for example, if we ask our client how he or she has been feeling lately, and then your client would say, I don't feel well, my stomach really hurts. And then you might be able to follow up and ask about specific symptoms, okay? Like, what exactly do you feel? Then your client will provide you with specific answer, or when did this start? Okay, so it's very important to also use not only open-ended questions, but closed-ended questions as well. And then we have this, what we call as the laundry list. Okay, these are manner of communicating or questioning wherein our client can choose, right? Can choose from among, okay, the quote unquote, the laundry list. Like, for example, if we ask the client to describe pain, so we can probably provide her or him the specific characteristics of pain. So you can ask, is the pain severe, dull, sharp, mild, cutting, or piercing? Then your client can choose which one appropriate description of pain that he or she has. Okay, so one way also that we can is to provide choices. Laundry list basically is providing our client choices to choose from to answer our question. And then we have rephrasing. Okay, rephrasing is an effective way of communicating and validating the information provided to us by our client. So when we say rephrasing, it helps us to clarify the information the client has stated. Okay, it also enables us and the client to reflect on what was said. Okay, so you can rephrase your client by, like for example, your client is saying that I am afraid where this hospitalization will lead me. Then maybe you can ask, um, are you thinking that your diagnosis would be a serious illness? So that is rephrasing. Okay. Then we can make use of well-placed phrases. Okay, we can encourage our client to verbalize using well-placed phrases. For example, if our client is in the middle of explaining a symptom or feeling and believes that you are not paying attention, you may fail to get or the necessary information. So it is important for you to listen closely to the client during um, the time that he or she is talking. Okay, you can use these phrases like okay, okay, and then by nodding your head, then that is um, telling your client, encouraging your client to go on, and then you can probably, oh, I'm sorry about that. Okay, or you can say uh-huh, uh-huh. Okay. So these are well placed phrases. So we can use this in between conversation to encourage our client to keep talking at the same time to give an impression that we are really listening. We also have inferring. So when we infer, we give back to the client what he just said and what you have observed when in terms of the client's behavior. So you need to as well be careful not to lead your client to answer give you answers that are not true. Say, like, for example, you have a client who just told you about a pain somewhere in his stomach, and you saw the client point out on the lower side of his lower abdomen. So you might probably say that you infer, and then you say that it looks like that your pain is more on the right side of your stomach. Okay, so that is inferring. And then we also have providing information. Our client might have questions as we go through with the interview, and that makes sure that you answer every question as thoroughly as you can. And if you don't know the answer, then you can explain to your client that you will find out for it for her. Okay, and it's very important to answer thoroughly, okay, directly, because the more your client knows about his or her health, the more likely he or she could become an active participant in caring for their own health as well. So we have to be careful to use nonverbal communication also, so that we might be able to show our client that we are willing to provide the necessary information that they need. So, what are the things, or what are those that we need to avoid for our verbal communication? First is avoid using biased or leading questions. So, like, for example, if you have a bias about our clients' practices, so we have to be careful to ask questions that are bordering on biased by our biases, as well as leading question that our client may feel that you have provided the answer already. And then rushing through the interview. Okay, so rushing through the interview would mean that we are in a hurry and that we are not providing our client the necessary time to answer and provide us the correct and the accurate answer. And reading the questions, we have our questionnaire, we might have our guide, but it is important for us to be more attentive to our client than to the question. Okay, so if our client sees us reading the question, it may look like we are not sure of what we're doing. At the same time, we are not paying attention to our client, and so we miss the non-verbal communication cues that our client is providing us. What are the techniques that enhance data collection? First, we have active listening. So when we say active listening, that is using everything of your senses when you are listening to your client. So we are noticing not only the verbal or the spoken words, we are also noticing and observing the nonverbal behaviors. We are trying to um, looking for subtle messages, or if the client's words go well with what our client's gestures are showing. And at the same time, we it allows us to see if, like, for example, we can as well show show our client that we are listening by like leaning on forward to him or her, and at the same time asking question, clarifying. And then we have facilitation. We facilitate so that we can encourage our client continue talking so we can use appropriate phrases, I mean. And then we have clarification, that is great, um, asking more questions so that we can clarify what the client had told us. So, like for example, if our client is saying that I think I am a hopeless case, so we can probably said, what do you mean when you said you're a hopeless case? So that our client will be able to elaborate upon what he or she just said. And we can also use restatement. So, like for example, when our client said, I think I'm a hopeless case. So we can restate, like, for example, are you saying that you feel hopeless? So we can do restatement as well. And then we can have reflection, that is giving back the client to the client what he just said. Like, for example, our client said, I don't think I feel bad. Okay? So you ask, you feel bad? So that is reflecting. And then our client could describe it more for us. And then we have confrontation. So when we say confrontation, that is um, giving back to the client, not to clarify any inconsistencies that we had noted. So when we confront our client, we have to be mindful of our tone, of our expression, so that we don't convey like we are angry or accusing a client for lying to us. So, like for example, when we want to confront about any discrepancy on what the client had said, let's say for example, we can say like, you told me that you are very careful with your health and that um, you exercise regularly, you're mindful of your caloric intake. Can you clarify or can you tell me why you are gaining weight if that's the case? So we are confronting the client because we might be seeing any discrepancy with what he or she is telling us, with what his situation looks on our side. And then we have interpretation, that is drawing conclusion from the data our client had given us. So this allows our client to either confirm, deny, or revise our interpretation. Okay, so we can say that you said that last week you were having a very stressful time, which you think resulted to you not being able to sleep well. Thus, you are coming over to have counseling, or you want to be checked because you are now experiencing anxiety, that you think you want to know more about your condition. That is interpretation. We can summarize, that is providing a summary of the data that we had obtained. The purpose of this is really to validate and to allow our client to clarify the data that we had gathered. Now, what are the techniques that could diminish data collection? Again, we have talked a while ago that when we use medical terminology, our client may not be able to fully understand it. So it's very important to use common words. Like, for example, instead of hypertension, we we say high blood pressure. Instead of CVA, we say stroke. Instead of myocardial infarction, we say heart attack. Okay, because medical terminology might confuse our clients and might cause misunderstanding, and so they can give us a reply that, or the data that are not accurate. And then expressing value judgment. Okay, so like for example, if we ask our client or force question to our client to to rationalize or provide a defense about their practices, so that could diminish data collection. Interrupting our client, of course, who wants to be interrupted while talking. So it's very important for us to allow our client to finish what they're saying. Okay, so we can clarify, we can reflect once the client is done talking, but let us avoid interrupting them while they are talking. And then we have being authoritarian or paternalistic. So when we do this, we show or we convey a message or something like we are in more authority. We know better. Okay, so when we do this, we can hinder our client from opening to us. And then we can, when we use why questions, like we 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 make our client become defensive of what they are doing, so we try to lessen or ultimately avoid asking why question, because we want our client to open up to us. We don't want them to be defensive. Okay, so it's very important to avoid using the why questions. What are the special considerations during an interview? We need to consider the age. So, like for example, our client is an older adult, and we have to first assess their hearing acuity, because we know that hearing loss or diminishing the sense of hearing occurs with age, right? So it could be that our client has difficulty hearing, so it's very important to observe if our client does have this hearing loss. So it's important to face our client during the interview and position yourself so that you are speaking on and not yell at the client. Okay. And then older clients may also have more health concerns than younger clients. So it's important to employ effective communication techniques so that they'll be able to trust us, and then they will not feel vulnerable and scared, and then they will not feel like they're being judged. Okay, and then it's important also for us to speak clearly and use straightforward languages. Some of them might not be familiar with medical jargon and the modern slang words that young people are using. So be very careful that you use direct words that they can easily understand. And so it's important that if they're older people, that we show respect. Okay, and so regardless if they show confusion or forgetfulness, please don't please what do you call this, please ensure that you show respect and judge and not being judgmental to your client. And then we also have cultural variation. So it's important to know the cultural practices of our clients, so that we can encourage them to open up to us. Because if, yeah, for example, if our client knows that we nurses have a different culture belief or religious belief than theirs, then they might have this reluctance to reveal personal information to us, especially that this is the first time that they had encountered us, they were able to talk to us. And so cultural variations could also affect their willingness to express their emotions, right? And it's very important to convey a non-judgmental attitude and an accepting attitude, as well as the language, no, how they speak certain terms, how they convey this certain messages. So it's important also to be mindful of how or what nonverbal or how these gestures or nonverbal cues mean to them as to their culture, because for us, specific gestures might mean nothing, but for them it may mean something. As well as different cultures might have different perception when it comes to illness and disease and health, as well as they might have varied past, present, or future orientation than us. At the same time, we need to know as well the role of the family in the decision making process, because there are some cultures that um, they're very particular with the family's decision when it comes to um, major major decisions that they have to make. So it's very important for us to consider that as well. And then we have emotional variations. So some of our clients might be scared, anxious, or angry. Some may have sensitive issues. And so we can exhaust all means to make our client feel relaxed and at ease with us. But in the event that we have to perform, uh, we have to gather data while they are scared, anxious, or angry, or disgusted. We can use focus assessment. We can focus on their problem or their situation, because we know that when a client is scared, anxious, or angry, we most often than not cannot gather accurate or timely data that we need. Okay, and so we have to be we have to take note as well with this variation that could affect our interview.